everybody, I hope you're having a wonderful day, and I just filmed a video putting oil on my face, so I didn't really feel like putting much makeup on because it's evening and my skin's breathing and my husband's not home, so I figured I'd just take it nice and easy tonight and just, you know, let my skin breathe a little bit. And I do have, I mean, I put a little foundation on, a little bit of lip gloss, and really that's about it. So anyway, I wanted to kind of update everybody, or kind of, you know, go into a little bit more depth about what's going on with me health-wise. I had some people that actually said that this might be helpful for them. And so I'm hoping maybe this will help some other people out there, and also will give me an outlet to talk about things, and hopefully give other people an outlet, you know, where you can, you know, have conversations with me and with other people, and just not keep everything inside, because that's really, really hard to do when you're going through something health related. That's so difficult to do. But back at the end of February, as most of you probably know, I did stop doing videos on my channel, and I just started back a couple weeks ago. And the main reason I did that was because I went into a fairly deep depression, because I started having a lot of pain right here in my wrist. And then I went to our regional first care, and I got x-rays done. They thought I might have a brace. They gave me a brace. They gave me some Mobic to take, and I got in with my orthopedic, who's also the orthopedic that did a wonderful job on my ankle surgery. And I got in with him, and he did MRIs on my hand, and he said he thought initially it might be a small break in one of the carpal bones in there. It could be damaged ligaments, it could be a torn tendon. He just really wasn't sure. And nothing actually was showing up on an x-ray at that point. And he said it could be like a hairline fracture or something. So he had me get an MRI, and we did find that I have a small little tiny cyst here and here, but that is not what was causing the problem. And so he determined basically at that time that more than likely I had tendonitis going on all through my hand and my wrist. And so he changed the Mobic to be twice a day. And right about that same time that I went back to him, this wrist started hurting right here. So I spent several months with both hands in a wrist brace, pretty much 24/7, taking anti-inflammatories, seeing if it would clear up. Well, it didn't clear up, and I have not been able to resume working and doing massage since the end of February due to this and everything else that's going on with me physically. I physically cannot do it because of pain and everything else. But so I spent several months in wrist braces and taking Mobic to help it in case it was tendonitis, because that's what he assumed it was, since there was no evidence of anything more than tendonitis. So after that, after several months of treatment, it just wasn't getting better. It was actually getting worse. I was having some numbness going down into these two fingers a little bit from time to time. I was having some shooting pains going down into my joints, and the pain radiated all around my wrist on both of them. And I had some achiness going up my arm, my forearm, which I was used to that because of doing massage. You do wear your forearms out, you know, and they do get really tender at times and really tight, and you have to have them worked out and everything. But this was different. And because of the fact that treatment wasn't helping and that it was getting worse, and I had the pain here and here, so it was bilateral and was originating in the exact same place in both hands, he decided to send me to a rheumatologist. And he my orthopedic, of course he doesn't know because he's not a rheumatologist, he suspected either rheumatoid arthritis or lupus, and I'm 35 years old, so I don't, I just don't really see, I just like, I can't get that. I'm too young to get that, because I asked him, I was like, do other people my age get this? He's like, I've seen people as young as 8 get rheumatoid arthritis. So, I realized that it was, more than, an age thing. And I've done some research, and actually this kind of stuff is normal to show up in people my age. And then after I did some research on my family, we did find some family history with autoimmune diseases, in particular rheumatoid arthritis, although back then, like my mom's mother had rheumatoid arthritis. She was diagnosed at age 26. And a lot of my mom's side of the family has rheumatoid arthritis. But who knows if that diagnosis was accurate then, because there's so many more diagnoses now than there were back then. And there is one known case on my grandmother's side, on the other side of my family, of rheumatoid arthritis, and one of osteoarthritis. And yet again, was it truly rheumatoid arthritis or was it something else? And then my dad's side of the family, we don't know much family history about them, just for various reasons. And so, that kind of got me concerned. Well, I saw the rheumatologist a week and a half ago, and the rheumatologist I saw, he had really, really high ratings on health grades and everything. So I felt pretty comfortable with him, and he was who my orthopedic really wanted me to see. And Dr. Chafin is absolutely awesome. He's like a year older than me, but he seems to really be on top of, he appears at least at this point to be really on top of things and wanting to figure out what's going on with you and trying to help you feel better. Well, some of the symptoms I've really been having was, and I've always thought it was rosacea, we're not real sure now, with the redness all through my face. That started back probably about 5 years ago, and it would get like, it would get just really bright red at times, and even just, it can show through the heaviest of makeup at times when it's really bad. But I was having that, and all these symptoms have kind of been increasing over, some of them are more recent. Some of these have been started a couple years ago and have gotten progressively worse. I've been having a ton of fatigue, to the point, and also insomnia, which is crazy, fatigue and insomnia. I can't go to sleep, but I can't wake up once I do fall asleep. I started a couple years ago, I started having a little bit of neuropathy or numbness like in my toes, and then it started moving through my feet, and that's when I started having a lot of the burning in my feet, and I noticed more shooting pains, and also I started noticing that I have a lot of bilateral pains on each of my ankles and feet, even though I have never injured my left foot or ankle. Only my right one has been injured, and also around my knees, and a lot of stiffness, like when I get up, like when I stand up, I notice that, like, especially my legs are stiff, my hands stay stiff. I mean, I sit there and do this a lot to try to get my hands to start moving, but it's like I don't have a real good grasp on things. Sometimes I feel like I can't lift heavy stuff. Either it hurts or I don't feel like I have the strength. There were a lot of times, like after getting out of the shower, and this is more recently, I would just flop on my bed, I couldn't even hardly lift my arms. I was just so exhausted. And my arms felt really, really heavy. And another symptom that was really concerning to me was the fact that I've been running a fever, starting usually in the late afternoon to early evening and running through, part of the night. And I run a fever usually about 99.5 to a little over 100. and it starts around the same time every day. I know when I'm running a fever. I can tell I'm running one right now because I'm sweating, and when I get these fevers, instead of chilling like you would think you would do, I get extremely hot and sweaty. And one night I sweated through 2 or 3 pairs of pajamas just sitting watching TV. And we keep our house rather cold, so that was really odd. That was really not normal. And so I have told the rheumatologist all this, and he's doing a bunch of blood tests right now. They took like 6 vials of blood, which of course I didn't look at because I'm kind of squeamish. But they were checking for all sorts of things, and he said he didn't want to label me with like a specific diagnosis at my age that he couldn't take back. There is a diagnosis per se on like the form that I got from the doctor. It does say inflammatory polyarthritis. Because he did go through, one thing that he did was, and he spent like 40 minutes with me on this first visit, which I was really impressed with. But he went through with an ultrasound and actually ultrasound every joint in my hands, and in particularly this hand. He didn't see any damage at this point, which is a good thing, but he said that he could see a lot of inflammation. And he's checking. He doesn't think it's lupus. I mean, he's not positive. It could be. I hope not, because although I hope it's not any of these things, because they can all be really bad, you know, depending on how they affect your body. But all these things can be super bad. But luckily treatments are a lot better than they used to be. And so treatments, you know, most people live a pretty full normal life with most of these things now. But luckily there's no damage. There's a ton of inflammation in my joints. And I think he may be looking at like rheumatoid arthritis. He mentioned Sjogren's disease. I'm not sure exactly what that is, but it's Sjogren', I think. And I think part of that has a lot to do with, he thought that maybe because of the fact that my eyes and mouth have been super dry. And I mean, if you notice, I do blink a lot, and it's because my eyes are just so dry all the time. I'm always using drops in my eyes, and I'm always sipping on drinks of some sort or have a mint in my mouth or something. But I'll say this is something, it's probably been coming on for years and I just didn't realize it. I don't know. But the other day I did get, and it was almost a week after I had gone to him and they had taken the blood sample and everything. And I did get a call from his office, and they said that I was anemic, which I was kind of surprised at because I eat a lot of stuff with iron in it. Ate a lot of meat. I love red meat. You know, I love meat and seafood and all that kind of stuff. So, I mean, I do eat a lot of seeds and nuts and just stuff with a lot of iron in it. And so I was really kind of surprised. They said my hemoglobin was 9.5, which I looked up online, and it was like, that's right there at the cutoff, the high end of moderate, the low end of mild, from what I was reading. I look at a lot of the Mayo Clinic and WebMD kind of stuff to get a lot of information because I feel like they're more reliable. But what was I saying? Let's say memory loss is cognition problems can be also another sign of anemia, and some of these other things, which explains a lot. So just give me a second. What was I saying? Yeah, and they said I needed to go see my primary care doctor as soon as I could get in with him, and they were going to fax over the blood work that they had. to him and told me to call that doctor's office in like about 5 minutes. And so I did call them, and I got in for the next day, which was this past Thursday, and they checked my hemoglobin there, and it was 8.8, and they ran the test twice, so it was not a false positive. And those tests luckily don't take but a minute to run as long as your doctor has that machine. And they were also able to check my iron levels, and so my iron was also low, which is, I guess, more of like an iron deficient anemia, or iron deficiency anemia. I mean, I still don't know the root cause of it, and I have been told on the phone talking to my doctor's office the other day that you don't really want it to fall much below 9.5. So when it hit 8.8 that day, I was kind of freaked out, but my doctor assured me that, you know, it can fluctuate, and 8.8, you know, they could test it a little while later and it could go back up. So that kind of made me feel better in a way. They did tell me if it got down to 6 or below, that I would have to have a transfusion, which was another thing that, you know, I'm not prepared for that. So hopefully that will not happen. I'm not expecting it to, but if it does, I'll roll with it. And he started me on iron supplements, and I started the iron supplement 2 days ago, and I didn't take it today. I'm gonna call him tomorrow, because the iron supplement was just started making me, after taking it a couple times, it made me extremely sick. I was literally in bed like all day yesterday. I was having like kidney pain in my back, and just last night my muscles in my arms were like just super weak. I've been achy all over. I mean, I really did not feel well at all. I'm feeling a lot better today than I was yesterday. So I'm going to call him and ask him, you know, is a different type of iron we can try? Is there another way to go about this? Like, do I need to go on slowly? You know, what do I need to do? So I'm going to call tomorrow and see what we can do about that. And I'm going to go back to the rheumatologist mid-August, and they said that I can come back to my primary care doctor's office before I go over there, you know, on the way there if I wanted to, because they're close to each other, and actually get my hemoglobin and iron checked then, and have that to take over with me to my rheumatologist. Yeah, but my primary care doctor did say that if my hemoglobin stuff doesn't start coming up within a month, that, you know, I may have a major problem. I may have a much bigger problem. Now, one thing that did give me a little comfort was reading about anemia, and if I am to have rheumatoid arthritis, then, and all these autoimmune things can take a long time to diagnose, possibly, because they're so complex, and some of them act like others, and I mean, they're just, if you start reading about it, it's overwhelming, so I have to read a little bit at a time. But basically, hopefully my hemoglobin and everything will come back up pretty easily. Hopefully that it's just, you know, an absorption thing. I really hope that's all it is. It's just, you know, something as simple as that, or just not, for some reason, getting enough iron from my food. I don't know. But reading about anemia and like rheumatoid arthritis, if I do have rheumatoid arthritis, about 60% of people who have rheumatoid arthritis actually have anemia. And it has something to do with like when your body, with the inflammatory response in your body, and how your body attacks a lot of the red blood cells that the hemoglobin attaches to, and, you know, to transport the oxygen through your body. And so, so that is a common thing, which that's, you know, that's kind of comforting that is, you know, more common if I have that, which I don't know what I don't have a diagnosis, don't know when I will. But one thing I am trying to do, and just to see if it helps with inflammatory response, is I'm trying to change a little bit of my diet. Like, I'm trying, I love milk, and I love cheese, and I love red meat. So I mean, I love all that kind of stuff. And so I'm trying to drink less milk, and I've been for the past week and a day, I've been kind of experimenting with unsweetened vanilla almond milk, unsweetened coconut milk, and then I tried the Walmart brand of their vanilla soy milk, the organic kind, and it was like really watery and I just didn't care for it. But then my brother at his house, I tasted, they had the Silk brand soy milk, and it's just the original, and it does have cane sugar in it. But I did try some of that, and it was thicker and creamier and actually had a better taste. So basically I've been switching between the soy milk, the almond milk, and the coconut milk. I like all three of them, which is a good thing. The coconut milk is really just, it's very refreshing. So it's the almond milk. You do have to kind of drink it several times and kind of get used to it. But I'm trying to see if that will help with the inflammatory response. I'm also exploring trying more other options for like proteins besides so much red meat. I do eat a lot of seafood, which mostly like scallops and shrimp and that kind of stuff. I love seafood. Can't get enough of it. So, and grilled if you don't want fried, because fried food can actually be worse for your joints and just everything all together. But so I'm trying this, and the other day we did go to our local Earth Fair, which is just a natural grocery store, like a healthy grocery store. And I've never had tofu, and of course we don't know how to fix it. I don't like the taste of Asian food and soy sauce and teriyaki sauce, and I know tofu tastes the way it doesn't have any flavor, so it tastes like whatever you soak it in. And so I'm trying to figure out some ways to try tofu and maybe try to get accustomed to it and maybe add it into my diet more. They did have some like pre-baked tofu that was already seasoned, but it had soy sauce and stuff in it. But I found some pre-seasoned soy burgers, and I liked all the seasonings in there, and they didn't look like Boca burgers, because I don't like Boca burgers. Those are just gross. No offense to you, if you love them. But I got these. I haven't tried them yet. We just got them Friday night, and then yesterday I wasn't feeling well. So I am going to give those a shot, see if I like them grilled, because we grill out a lot. And just, I'm going to start trying to slowly incorporate more things and try to eat less meat with all the antibiotics in it and hormones, and just see if it makes a difference. And I want to do it very slowly, just so I can see if I can tell if anything's making a difference. And, and eventually, hopefully, I will be able to see, cutting back on cow's milk is really helping, or cutting back on, some of the red meat or some of the meat with hormones in it, and eating more seafood is helping, just whatever will help. Because I do want to do what my doctor says to do, but I also want to do anything I personally can to help myself get better, because I'm one of those people who wants to take an active role in what they're doing. And so anyway, this has been long enough. I'm sure you're probably getting bored, but if anybody else is having any similar experiences, feel free to respond. Tell me your experiences. You're welcome to send me a message, or whatever you want to do. And I can tell you what I'm doing, and and I'll keep you kind of updated as I know new things, or as I'm trying different things. I'll keep you updated as to what is going on, and just hopefully this will help somebody else out there. This is giving me an outlet to talk, and hopefully this will give somebody else something, they can realize they're not the only one going through this. And so anyway, thank you for listening to me, and I hope I didn't talk your ear off. But feel free to subscribe, and I will continue doing beauty stuff, and I'm thinking about adding some different stuff into my channel just to make it all more interesting and more me. So anyway, take care and subscribe, and I will talk to you all very, very soon. Bye.